Okay, what do you consider as obesity?
Obesity is defined by lots of things. So you get, obviously overweight is at one category, and it's when it then to clinical obesity, where there's sort of comorbid factors involved as well. So their life has become directed by their weight. That's the thing. Yeah.
Alright, and what would you say is the best way to cure obesity?
Best way is diet and lifestyle changes. Obviously, it's an intervention, changing the lifestyle and diet. You've obviously got to establish and determine what are the contributing factors to them being obese.
Yeah.
So there can be medications, there can be all sorts of different reasons for obesity. So it can be just a matter of overeating and inactivity, but it also can be sort of genetic predispositions and things like that as well. So it depends what kind of condition they're in, how big they are, whether it's changing their life, whether they're bed-bound, whether they can still function normally, and that sort of thing. And then it also depends then if they have other predisposing factors, so if they have a high blood pressure, cholesterol, or diabetes with that as well. So it depends what they have as to how we treat them. It's an individual case-by-case basis. But it's a matter of, more than not, it's a matter of changing lifestyle and behavioural patterns and things like that.
Right.
Getting active.
Yeah. Do you think obesity is more, generally it's got more to do with your food habits?
Yeah, absolutely. Definitely, because you can't get big unless you eat the wrong sorts of food or the wrong amounts of food. So definitely it's food and activity. Because you get some people here who work out at the gym and they can eat a lot, but it's because they've trained that they can afford to eat more. But people who don't do any kind of activity, they can't eat so much.
Now, have you heard of Senegal?
Senegal?
Yeah.
Yes.
Alright. What do you think of using Senegal?
There's lots of little helpful little tools along the way. I don't think that we need them. You don't need those added drugs or therapies. You can simply change with exercise and diet. We don't promote or push any type of stimulants or drugs to be taken. So we encourage more of a behavioural change. It has to be long term. It has to be safe.
Yeah. So basically what you would say is that you would promote exercise and teach them to have a healthier lifestyle.
Absolutely, and then work with them to achieve that as well. Like you can't just give someone the information and expect that they will do that. You need to be able to, rather than just promoting it, you need to be able to sort of say to them that, we'll help you do this and this and this, little steps at a time.
Right.
Yeah. It's a long-term thing. Weight loss is long-term, so you need to be committed on a long-term basis.
Do you think obesity is would you call it a disease or a sickness?
It definitely is. Clinical obesity, yeah.
And what do you think like you've written about surgery and lab and all that. Is it possible, are these procedures safe?
The procedures that can help is clinical obese, so someone who is bed-bound, someone who can physically has more weight to lose than they are at a healthy weight. So we're talking excessive amounts of weight, in excess of sort of 100 kilos and things like that. Those surgeries can help, they are beneficial. They do have the added benefit of losing the weight so that the health complications aren't a problem. But, they're not recommended to everyday people. We're not talking about overweight here, we're talking about clinical obesity. So in clinical obesity, they have their place, yes, but not for everyone.
Okay, and now, if someone were obese like today, what would you tell them first?
If someone who's obese today?
Yeah. As in if someone walked in and said that I'm obese and I need to lose weight or whatever.
Yep. It depends firstly where they get their information, so whether they actually fall into obese category or just overweight. And they obviously need doctor's consent to walk in here. So I need to see that their doctor has given them permission to get physically active. Here at the Club, and what we do as Biogenesis is incorporating the exercise program. with regard to their own nutrition. They need to get some information. Obviously we give them some of the government recommendations on food and intake, so they can start modifying what they're choosing to eat. And the government provides those guidelines. And so we can give them a handbook or something like that. But obviously they need to get active. They need to be assessed whether they're fit enough and able enough. The doctor has to give them consent that they can start training. And then once all those parties are involved, we can give them, weekly schedules and what they can do for exercise.
All right.
Yeah.
And would you say it's easy for a person who's obese to actually, lose the weight?
There's, like with any decision, there's a pre-contemplative stage, there's a contemplation stage. It's for someone who is obese, it's a very emotional thing as well. So that's difficult. Weight loss is relatively easy, because when someone is so big, they can lose lots of weight, but they have to be committed. So it's about a commitment as well. It's very emotional, very personal thing.
Okay, I think that's all.
No problem.